Julia. I come to you from Smiles Nutrition and Wellness Center. This is a wellness center that seeks to address root causes of illness. When we address root causes of illness, we are able to prevent chronic illnesses, cure or reverse chronic illnesses, help you manage your body weight, prevent or reduce susceptibility to infections, and delay premature aging. Today, I want to talk to you about improving your immune system in the context of the COVID-19 virus. Welcome. We have learned a lot now that we've had COVID around for some time, and a lot of studies have been done to guide us and to make us wiser in the event we experience more waves, either in the near future or in the far future. Besides vaccines, there are choices in regard to your lifestyle and diet that play a big role in your immune function. Diet and the microbiome closely relate, and I'll explain what the microbiome is. As far as diet is concerned, we want you to have micronutrients that improve your immune function. This includes zinc, magnesium, B complex, vitamin C, vitamin D, vitamin A, vitamin E, and glutathione, and the B complex. Zinc is very critical because it plays a role in many enzymatic functions of the body, some of which have to do with the immune system. Zinc is also very important in the maintenance of the thymus gland. This is the gland in which some of the white blood cells go to mature. When you don't take adequate zinc, the thymus tends to atrophy. That simply means it becomes smaller and smaller and loses function. The other nutrient that is important to the thymus is selenium. So you really want enough of zinc and selenium. Thirdly, zinc enters into cells that are affected by the virus and prevents the virus from multiplying. Then we have quercetin. We find quercetin in onions, tomatoes, green and black tea, and so forth. Quercetin has multiple roles. Number one, it helps zinc to access the cells and carry out its function. Secondly, it regulates what we call mast cells, and these are part of our immune system that are meant to help us fight toxins such as those that we get from viruses. But when they get out of control, usually the products they make become harmful and actually have been associated with a lot of the damage we have seen in the SARS-CoV infections. So you want your quercetin to help regulate your mast cells. Then we have magnesium. Magnesium plays a role in many enzymatic functions, some of which belong to the immune system. Vitamin A and D work alongside each other. They help to prevent susceptibility to infections through multiple mechanisms. You get your vitamin A from beta carotene, and this is mainly found in leafy green vegetables and colored vegetables such as carrots and colored capsicums. You can tell you have vitamin A deficiency when you don't see very well at night and when you're very prone to infections. Vitamin D, we get that mainly from exposing our skin to the sun on an average of 30 minutes a day for dark skins, preferably in the morning or late afternoon when it's not too hot. You can also get your vitamin D from mushrooms, fish, and fish oil. Vitamin D also plays a big role in the kidney function. The kidney is where we regulate a certain system in the body that I'll not discuss in detail because it's a bit technical, that plays a big role in the SARS-CoV infection. So you want adequate amounts of vitamin D. We also know that the global population is highly deficient in vitamin D, and living in sunny areas is not an indicator that you have enough vitamin D. You actively have to expose your skin to get enough vitamin D. Then we have what we call antioxidants. These are substances we get from our food that help to clean out the damage that the virus leaves behind. We have vitamin C, which we mainly get from our citrus fruits and fresh vegetables that are not excessively cooked. We have vitamin E, which we get from our seeds and nuts mainly. Avocado is a good source of vitamin E. We have glutathione. Glutathione is a very, very important antioxidant. And actually, studies have shown that most people who lost their life were very low in glutathione. It's the strongest of the antioxidants, and it's important because it can be recycled in the presence of vitamin C. It's made in the body, and foods such as carrots are a good source of glutathione. We also want you to avoid highly processed foods, especially sugar and carbohydrates. This is because these come in without sufficient minerals that the body requires to extract energy from them. And when you are low on, when you consume these foods, they tend to deplete these other nutrients because they need them to produce energy. We want you to avoid foods you're allergic to. How can you tell if you're allergic to food? When you take a food and you get skin reactions, you get a headache or a fog or stomach upset, you know you're allergic to food. But even more hidden are what we call intolerances and sensitivities. These are hidden because they don't manifest immediately after the food. They may take 3 or 4 or even more days to bring reactions. So you have to be very attentive and note if you eat something and then after several days, either you have a headache, a hazy headache, you have mental fog, you are probably having a slight fever, then query a food intolerance or sensitivity if no other cause is found. People who tend to have these allergies are also overly sensitive to other things such as perfume, dust, and cold. If you have a lot of mucus in your body, either in the nose, in the sinuses, in your chest, then you should also query either a food allergy, a food sensitivity, or intolerance. When we are clogged because of the mucus allergens produce, our immune system is not able to respond very fast when you're exposed to the virus. So you really want to clean up your system and clean up the mucus that allergens form by excluding them from your diet. There are other means of also cleaning up the body. Certain herbs and spices help us to clear out mucus out of the body. You want to avoid highly refined fats, and these are especially salad oils that are not cold pressed, or damaged fats such as margarines. You want to avoid excessively fried foods. You want to avoid nuts and seeds that are heated on high temperatures. This is because these are a source of inflammation in the body, and we know most of the people who have had severe forms of the SARS-CoV infection were people who already had inflammation before they got exposed to the virus. Inflammation is very important as far as COVID is concerned. And I'll use an example of what inflammation, what you can easily understand inflammation to be using the example of a pimple. When you have a pimple on your body, it will usually be painful, it will be swollen, it may be hot or feverish, and it may interfere with the body function. When you have inflammation in the body, you have all these characteristics, but at a low grade. So you don't feel them as you would with a pimple. But by having that in your body, you become susceptible to severe infections because those overwork the immune system and make it very active in a way that's damaging in the event it's exposed to a toxin such as we find in COVID-19. The microbiome. What's a microbiome? A microbiome is a collection of bacteria we have in our body. I know when we hear bacteria, we think of disease, but that is not always true. Naturally, even in good health, we have bacteria in our gut, in our eyes, in our nose, in our mouth. These bacteria play different roles. They help us to prevent infections by locking out or occupying those spaces so that when harmful pathogens such as the viruses and bacteria come from our external environment, they find them seated there to block them out. In the gut, they play multiple functions. They play a role in the immune system. They play a role in helping us absorb micronutrients and even digest our food. It's important to have good forms of bacteria because from the studies that have been done, those who suffered severe disease tended to have unhealthy forms of bacteria. And how can you tell you have unhealthy forms? There are many ways. One way is at the mouth, like if you have bad breath and bleeding gums and loose teeth, that is an indicator that you have abnormal forms of bacteria. If you tend to bloat a lot after your meals, that may be an indicator you have harmful forms of bacteria. If you have a lot of eczema, chronic skin conditions that tend not to be treated and resolved, then suspect you have a messed up microbiome. Currently, multiple autoimmune diseases such as rheumatoid arthritis and SLE have been linked to abnormal forms of the microbiome. Other things that you need to pay attention to when you are thinking of improving your microbiome is your diet. For a healthy microbiome, we need fiber and healthy fats in our diet. Fiber is the main food the microbiome subsists on. You want to avoid highly processed foods because sugars and flours tend to grow abnormal forms of bacteria in our gut. Excessive use of antibiotics and painkillers harm our microbiome. Avoid overuse of those unless they're prescribed. Alcohol and stress also affect our microbiome. You want to avoid stress. You want to avoid excessive intake of alcohol. Secondly, we have sleep. When you're talking about sleep, the main features we are interested in include the duration of your sleep, the timing of your sleep, and whether your sleep is restful or not. Sleep controls our hormones, and some of the hormones involved are cortisol and melatonin, and by extension, insulin. Cortisol is the hormone that fuels us during the day. When we stay awake into the night, we maintain high cortisol levels, which is not a good thing because at night, ideally, we want low cortisol levels. Melatonin, on the other hand, is the hormone that helps us to sleep. And so at night, you want high levels or adequate levels of melatonin. When you stay awake for long, you tend to have low melatonin at night. Cortisol has been demonstrated to lower our immunity because there's a certain protein that moves around our mucosal surfaces called secretory IgA. Anytime your cortisol levels are high at the wrong time, they tend to plunge that protein. Yet this protein is the first line of defense we have against viruses and other pathogens we want to stay away from. Cortisol also affects our blood sugar levels because when we have high cortisol levels at the wrong time, we tend to break down our muscle to produce energy. And when we break down our muscles, your sugar is very high, and high sugar levels are never good for the immune system. It doesn't do well when the sugar levels are raised. Melatonin has now been recognized as taking part in preventing chronic inflammation. It helps to calm down the body. It also has receptors on the organ called a pancreas that helps us to regulate our blood sugar. So you want to sleep on time, you want to sleep adequately, you want to have a restful sleep to regulate these hormones for the sake of your immune system to prevent susceptibility to COVID-19. Then we have stress. This is psychological stress and also other forms of stress that may come from injuries, pains and aches we have in the body, exposure to toxins in the environment or in our food, and so forth. Psychological stress, when we are very stressed, our cortisol levels shoot up, which is not a good thing. We also tend to deplete our micronutrients when we're stressed and deny these other important body functions, such as the immune system, of what they need. So during these times of COVID, we want you to manage your stress well, be it at home, be it at the workplace, so that you're not compromising your immune system. Last but not least, physical activity. And this has a myriad of benefits, but I'll just mention a few. When we are moving and exercising, our immune system also becomes active in a beneficial way. And so it's able to detect pathogens such as the virus on time and send signals that will ensure the virus is contained on time. Secondly, when we are moving and are active and are exercising, we improve our excretory function. And so the various organs involved in removing toxins in our body, including the viral toxins, will work better. So you have the liver, which is our main detox organ, improving in function with exercise. We have our lymphatic system, we have our bowels, and we have our sweat glands and kidneys working more efficiently. Before I finalize, I'll just add a small note on why some people are more susceptible than others. Those who've been more susceptible to the COVID-19 infection are those who have chronic diseases. And these include diabetes, hypertension, asthma, cancer, and so forth. The common denominator among all these illnesses has been found to be chronic inflammation. You may ask, but I know so and so who either got admitted or died and did not have disease. Sometimes these diseases take years and even decades to manifest. And so it's possible to have a disease in the making before you're diagnosed with the illness. A wellness checkup can help you identify whether you have underlying chronic inflammation before it causes a disease. The other variable that really came out clearly was body composition. When we have abnormal or high amounts of fat in our body, and especially in our midsection, whether we have a disease or not, those are harmful. Those fats in this area have been shown to produce harmful substances in the body. Now, these substances in small amounts, of course, are no problem, but in high amounts, they cause a lot of immune dysfunction, and these are called cytokines. So you really want to be attentive to your body composition so that you do not have cytokines circulating around your body, because I'm sure you've heard of the cytokine storm, and basically a cytokine storm occurs when you have pre-existing cytokines, you get exposed to the virus. The virus overstimulates your immune system, and these cytokines get out of control, causing harm to organs and especially the lungs. And so you get your lungs filling up with fluids from the inflammation and mucus, and so you're not able to breathe, and ultimately that's how you either end up in hospital or dead. Thank you for watching. I appreciate your audience.